All right, guys. Welcome, guys. My name is Dr. Isang, and I'm a cardiologist here in Knoxville, Tennessee, just using this platform to discuss things regarding the heart, health, and prevention. Usually trying to do this at least 3 to 5 times a week to help people answer any questions that they may have regarding their heart, regarding their health, regarding any potential risk factors. So why is this important? The biggest thing is that prevention is a lot better, it's a lot easier, it's a lot cheaper than treatment. So what does that mean even more? If the outcome that we do not want you to have is a heart attack, preventing it is knowing what the risk factors for a heart attack is and going after those risk factors to prevent a heart attack from occurring. Risk factors for heart attack includes things like hypertension or high blood pressure, high cholesterol, diabetes, a strong family history, tobacco use or smoking, drug use, other illicit drug use. So if you have any of these, I highly recommend for you to follow up with your primary care to get it treated appropriately so that you don't fall prey to something like a heart attack in the future. Um, so what exactly is a heart attack? A heart attack is an occlusion of the coronary artery. If you can see this a little bit closer, this is a model of the heart. The red is the arteries. If any of these arteries get occluded, that is a heart attack. And if you can see that these arteries are on different locations. So depending on which artery is occluded, that territory is lacking both blood and oxygen. And because of this, it can lead to muscle death and chest pain, which is usually one of the last symptoms that people typically present with after they've had a heart attack or when they're having a heart attack is chest pain. So it's very important that if you have any of those symptoms that you go get seen as soon as possible because we can potentially open that artery back up either with a stent or set you up for bypass surgery in which we bypass that damaged territory going to someplace else that has better oxygenation, a better territory to reroute the blood flow. Now, a lot of times, especially the things that happen to Damar Hamlin, the things that have happened to a lot of athletes who die suddenly in the field, we have something called cardiac arrest. One of the things I want to say is that cardiac arrest and heart attacks are not the same thing. So when someone has a cardiac arrest, that is an electrical issue with the heart, which leads to the heart not pumping at all. You can have abnormal rhythms such as ventricular tachycardia or ventricular fibrillation that causes that abnormality. You can have PEA, cardiac arrest, pulseless electrical activity. The heart is just not pumping. These people need CPR. Some of them even needs defibrillation where you shock the heart back into a normal rhythm. They need to be sent to the hospital for further evaluation because one of the biggest things that causes cardiac arrest is a heart attack itself. So different things, but one can lead to the other. Heart attack is an occlusion of the heart artery that causes muscle death and can also lead to abnormal rhythms. Cardiac arrest is an abnormal rhythm of itself in which the heart is not pumping effectively and needs defibrillation, needs CPR. So that brings up to the next topic, CPR. What is it? Why do we do it? What's the most important thing? CPR stands for cardiac pulmonary resuscitation. What we're trying to do is help the heart pump blood to the most important organs, also back to the heart while we send the individual, hopefully calling 911 or getting an AED to figure out what's going on. So if you find someone that doesn't have a pulse, is not responsive, start CPR as quickly as possible. One of the things that used to deter people from doing CPR used to be having to do mouth-to-mouth resuscitation. And now the AHA, American Heart Association, is now recommending for hands-only CPR to hopefully prevent this from being an issue. The biggest reason, the thing that I care about the most regarding this is that Out of hospital CPRs, the success rate is only about 5 to 10%. So 10 people that have a cardiac arrest outside of the hospital, out of that, only one will likely survive. We can potentially turn this into a 30% survival rate if we act promptly, if we start CPR quicker, if we start CPR quicker. So how fast do we want to go? We want to go 100 to 120 compressions every minute. One of the songs that people always think about in their mind is that Staying Alive song. Uh, 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 staying alive, staying alive, to help know how fast you should be going 100 to 120 compressions, how deep, 2 to 2.5 inches. No rescue breaths is necessary anymore, or no mouth-to-mouth breathing is necessary anymore. Just start pumping that chest as quickly as you can, as quickly as you find someone who is not responsive. And what next? After you've recovered the person, put them in the rescue position, turning them to the side. Hopefully 911 has already been called and they're on their way. And hope for the best. Pray that they recover appropriately. The American Heart Association does have on their website more information about CPR and what to do and what to expect. And hopefully you don't ever need to use it, but if you do have the capabilities, you can potentially save someone's life by knowing how to do CPR. And my third and last topic is going to be hypertension. So this is an elevated blood pressure. And the reason that it's important is that high blood pressure is also known as the silent killer. A lot of people who have an event don't even know that they had high blood pressure until it's over. So it's important to know that you may potentially have this and not have any symptoms. So either getting your own machine, going to a pharmacy and getting it checked, or having an establishment with a primary medical provider to get this checked is going to be key. The top number, one sits above 120, pre-hypertensive, 130, stage 1 hypertension, 140, stage 2 hypertension. Regardless of what your number is, my first recommendation is going to always be trying to lose the weight, trying to treat the blood pressure naturally without any medications. This includes weight loss. This includes watching what you're eating, the Mediterranean diet or the DASH diet, dietary approach to stop hypertension that focuses on fruits, vegetables, lean proteins, fish, chicken. Tries to avoid processed foods to the best of our and your abilities. Following up with primary care to make sure you don't have any other reasons to have high blood pressure, whether something else is pushing that high blood pressure, things like sleep apnea, renal artery stenosis, blockage in the kidney arteries, issues with your thyroid, issues with your hormones. All of those can play a huge factor. I do believe one of the biggest ones is poorly controlled sleep apnea. So a lot of times if you're overweight and if you snore, daytime sleepiness, typically want someone to have a sleep study done to rule out sleep apnea. So diet, exercise, weight loss, secondary hypertension, those are stress reduction, significant stress reduction. Stress is a huge component. So reducing it, whether that's through exercise itself, through yoga, meditating, or removing the stressors that's in your life, are key to helping to treat that blood pressure a lot more effectively. Unfortunately, there are some people who, despite all of this, will continue to have high blood pressure and need something else to be done. For these individuals, this is when I start to reach for medications. And there's a lot of medications: calcium channel blockers, beta blockers, ACE inhibitors, aldosterone receptor blockers, spironolactones, thiazides, isosorbides or nitrates. So a lot of times when I select a medication, it's not just picking it randomly, it's more or less picking the ones that will be appropriate for this individual. If someone has some leg swelling, ankle swelling, I don't want to pick calcium channel blocker because one of the side effects is ankle swelling. If someone has elevated potassium levels, I don't want to pick an ACE inhibitor or an aldosterone receptor blocker immediately because it can lead to hyperkalemia or elevated potassium levels. Regardless of all of this, when someone gets the diagnosis and I start them on medications, I typically want to check labs at least a week afterwards to make sure that the body is tolerating it well without any added issues with the electrolytes, potassium, calcium, magnesium being some of the ones that we will check afterwards. But that's just about it. I've talked a little bit about prevention, about heart disease, coronary disease, the differences between cardiac arrest and cardiac arrest and heart attacks. Not the same thing, but have some similar properties, and hypertension, high blood pressure. I'm gonna give another minute in case anybody has any questions. I'm not sure if people are able to even ask questions on this. I hope they are. But if no one doesn't have any questions, I will likely come off of here and start back again probably tomorrow. All right. Well, another good time. A little bit better turnout this time, so it lets me know that consistency, like in anything else, is always going to be key. Usually I've been talking to myself for the past couple of times, but now I've been seeing 2 to as high as 6 people, so let's get after it. I'll be back on probably tomorrow around nighttime, and I'll just keep on doing this until I get like a steady 20 to 30 people on here, and it's gonna be awesome. So anyone who is still watching this right now, shoot me a message. I'm on all of the social medias under the same name, Dr. Isang. Shoot me a message as my day one, so when we all blow up together, we can celebrate that you guys were here when I was struggling to get 1 to 3 people during a live session at a time. But I appreciate you guys, and I'll see you guys tomorrow.